He does not have any words. How he used to communicate is if he wants to water, if he wants any of the things that he needs, he used to drag us, he used to point out, he used to just keep our hand the thing on the thing that he needs. Now the good thing is now if you ask him to Arjun, what do you want? He says that one, I want water, or I want banana, or whatever the things that he needs.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, a doctorate in OT, specializing in neurology, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices of her homeland with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast series Autism Uprooted, Dr. Jodie A. Dashore.
Hello and welcome to another episode of BioNexus Health Podcast series Autism Uprooted. Today, we have with us a family of Indian origin, American Indian family that lives in Illinois. We have Gopi and his lovely wife, Jyoti, who will be sharing the story of their little son, Arjun, and his journey of recovery from autism spectrum disorder. Hello, Gopi and Jyoti. Really welcome to the show today. I'm very thankful that you guys have agreed to speak about your son. Can we start with you letting us know, when did your son get the diagnosis of autism spectrum disorder, and what did you try for him after you got the diagnosis? And then also, after trying all that, how did you find out about BioNexus Health and what brought you to BioNexus Health?
Yeah, first of all, thank you very much, Dr. Dashore, for having us on this podcast. Yeah, we cannot thank enough for what we have seen, the improvement that we have seen in Arjun. Just to give him a quick background, Arjun, he was born in 2015, and up to 1.5 years, we see him as a normal kid. We didn't see that one. No, he hit all the milestones. We didn't have any issues. He used to play with his sister really good, and also we did. And the development, as we said, development wise, he make every progress. And he was when we go to the pediatrician visits, on all his what you call that one, on the development was he's at 68% when it compares to the piece. So we felt everything was going good. So around that 1.5 year mark, we see a little difference where Arjun, if you call his name, he was not responding. Earlier, no, we were thinking that for the things that he liked, he used to respond very fast and he used to be very prompt. So we were thinking that since he does not like few things, that's the reason why he was not responding. Mm-hmm. So we had the same when we went for the doctor visit, for pediatrician visit around 1.5 year.
Okay.
The doctor has asked to fill up certain questionnaire. So he was asked, is he responding to the name? So he said no for most of the time. If he likes, he will respond. But if he does not like, he does not respond. So immediately he suggested us to go for the hearing test. So we went for the hearing test immediately right after, around 2 weeks after that time frame. Mm-hmm. So in the hearing test, it's they make a lot of noise because he was 1.5 year kid. So they have a lot of dolls around the room, and the dolls make noise.
Okay.
What they seen during that evaluation is the kid responding to the sound. That's why they will analyze whether he has any of the problem with the hearing or not. But mm-hmm. Unfortunately, Arjun, he did not pass that the exam, whatever they conducted.
I'm sorry. So for the hearing test, he did not pass the test at that time.
That means they have the score evaluation, and right. They said that he was responding only for few of the the sounds, and he was not responding to the few of the sounds.
Okay.
So they gave us to go for further test. So at that time, Arjun he moved back to India around that time frame, and we did the complete cochlear test. I don't know whether I pronounced it correctly. That gives us the what's going on with the hearing.
Okay.
So when we did the test, it was come as normal.
Okay.
So after that one, no, during in India, we had in not family, the close doctor where we take Arjun to the doctor, because at the time I think between that 1.5 year time frame to 2 year time frame, whatever the words that he acquired during that between 1 to 2 years, he's kind of losing that. So that gives us a flag. So we take him to the doctor. He said that, well, no, looks like he's a speech delay, and just give us some of the medicines, like what is that one? Some herbal medicines, which is herbal medicine. So
Okay.
everything will be all right. I think, I don't know what is that exact, lemongrass or something like that one, doctor.
Okay.
Yeah. So she was suggesting everything will be all right. So that's where we spent that 4 or 5 months, and since even next we introduced to one more doctor in India itself. So that's where he was diagnosed with mild autism. So immediately when he diagnosed with mild autism in India, we thought it will be better in the states over here, because we do have a lot of therapies over here. That's why immediately he came back to the United States over here.
Okay.
Immediately after he come to the United States, we went to the ear checkup one more time. At that time, he was diagnosed that he has the ear fluids in both his eyes, in both his ears. So we thought that is the problem. That's why he's not responding. So we did chiropractic for ear fluids removal. Unfortunately, it did not work. So we went for the minor surgery. So we were thinking nothing's going to be all right right after the surgery. We waited for a month or so, but we didn't see anything that has changed. So again, immediately we booked the appointment with the development pediatrician over here in the States. So that's where even he was diagnosed again with mild autism, mild to moderate, I would say, mild autism. So after we had appointment with the development pediatrician, what we did was doctor suggested, he did not provide any medication. He just only suggested the iron capsules, and also he suggested to go with fish oil.
Okay.
So meanwhile, when I was searching at the time, autism was altogether a new thing to us, and we don't know that one there is a term called as autism as well. So when I was searching through in the websites, I got to know that one now. Recently, there was some protocol that is going to be clicked for most of the kids. So I'm not naming the DOT protocol, but I started that protocol immediately within a couple of weeks. I see that when there is improvement. But the thing was, when the days pass by, whatever the improvement I see, that they used to disappear in right after a few days. So when we check in that group, we were told that one, hey, that is how it's going to be. But when the days pass by, everything will be stick together.
Question for you. I'm sorry. So
Sure.
you're saying that, because many parents turn to online groups for support, and they're
Exactly.
fantastic. I remember I received some help, some pointers in the right direction early on with my son when we were trying to recover my son. But so you followed that advice for a little bit, and you saw a little bit of improvement, but that improvement did not stick.
Exactly, that's the right word. It never used to stick. Whatever he used to speak today, or whatever the words that he used to stick today, if you ask him after a couple of days, he never used to repeat that.
Okay, I see. All right, go ahead.
Yeah. And after that, I would say that when we continue with that protocol. Just only it has 3 components. It has fish oil. It has the major component called as inulin, and also it has extra virgin olive oil.
Mhm.
That's where it says that one it reduced the inflammation. So we started them. We tried them for close to 9 months. So after that one, now we left that one because whatever the improvements that we see, it never used to stick. So after that, for a couple of months, we introduced him to the Ayurvedic medicine like um, what you call as
Swarnavacha
yeah,
and Brahmi,
Swarnavacha,
Okay.
Brahmi powder just for
Okay.
the
brain
brain. Yeah,
development.
and there as well we see improvement. Is more he used to be more babbling a lot at the time. So the same
So,
time I
okay.
spent yeah, gone.
Sorry. So he started, when you say Ayurvedic medicine, you mentioned Brahmi, so this is like something that is, Brahmi is Bacopa Monieri. Now that
Exactly.
is right. So that is like a lot of stimulation for the brain. And I'm actually surprised that, I guess that is symptomatic treatment at this point, right?
Yeah, exactly.
You were looking to just go directly and fix the brain, and I'm sure as we progress with your journey,
Yep,
with your son, with Arjun, we'll see that a lot of underlying things have to be addressed before anything uh, like direct brain stimulation is undertaken, right? The brain has to be ready for that
exactly.
stimulation. The brain has to be ready to form those connections because herbs can be powerful.
Exactly. That's where we found out this brilliant Dr. Dashore. How we found out Dr. Dashore was I was going through the online, especially the autism one, and also
Okay.
where Dr. Dashore has given the her opinion about what are the symptoms, what are the causes that can cause the child with autism, and I heard about the podcast that Dr. Dashore was part of. The podcast with sorry, I'm not getting the name.
That's
um,
okay.
yeah, I'm sorry, I'm not getting
That's
the
all
name.
right.
Yeah, so that's where I got to know that one, hey, this is the underlying cause. That's Arjun, that's the reason why Arjun was like this. So immediately right after that, when I am so impressed by the lecture that Dr. has given in the autism one group, and I also yeah in other podcast. So immediately I started looking for the BioNexus, and that's where I found out most of the information which is relevant to for Arjun. So immediately I book an appointment without second thought. Even at that time, I don't know who is Dr. Dashore is about. I just heard about her in the Autism One group, but I didn't even check with any of the parents. With my gut, I just booked an appointment. And after that one, whatever we see this improvement is currently, that is then what you see from past 1.5 years to now, it is an history.
Yes. Oh, okay. Yes. Yeah. So you guys, well, you were speaking about me in the third person, and that's great. So people understand exactly how your approach has been, how you found me. Yes, I have many podcasts, and so I'm glad that it reached you. I'm glad. Autism One is a truly wonderful international conference, which brings a lot of hope to a lot of families, which is the goal of this podcast as well, is to bring a lot of hope and healing to families across the world, because there isn't a whole lot of knowledge about autism and how to look at underlying comorbid issues. There can be improvement. I believe recovery is possible. As you know, I've been on the same journey with my son.
Exactly.
From what I recall, I think the United States practitioner, physician that you saw, had the more accurate diagnosis of moderate autism. Because I remember in the beginning when I first met Arjun,
Yeah,
like about 1.5 years ago, so you had mentioned that he had things like hand flapping, teeth grinding, right, hyperactivity behaviors,
exactly.
toe walking. He was not able to communicate his needs.
Absolutely.
So I'll let you elaborate that. So if you can please talk about Arjun's symptoms
Yeah.
with behavior, cognition, speech, communication, as well as his gut I think you mentioned rashes. So if you can explain a bit more.
Exactly. Yeah. To give a little background, during that around that 1 year time frame, what we used to see most of the issues with Arjun was he used to have frequent cold and cough and fever.
Oh, okay.
So we introduced some lot of medicine at that time. Maybe that might be the one of the reason. That's where even when we took him to the ear fluid test as well. Sorry, yeah, hearing test as well. That's where we got to know that when there was ear fluids, that we got to know that one that also causes frequent cold and cough.
Okay.
So that was his health history and voice. But before we introduce to Dr. Dashore, the main issues that with Arjun that what we used to see is, as Doctor has quoted, he used to do hand flapping, and also he used to walk on the tippy toes. Not
Mhm.
most of the time, but at least he used to walk frequent times. And also he used to grind his teeth very frequently, and that used to be, yeah, he used to grind it very loud sometimes as well. So and especially when his gut also, I would say that um, I could clearly see the difference between before we introduced to doctor and before after we introduced to doctor, which we'll discuss a little later now.
Right.
Um, it frequently earlier he used to have health issues like it can be cold, cough, or it can be a flu, or it can be
Mhm.
fever.
Mhm.
And at the time his appetite was also very limited. He only used to eat only limited food, that too, yeah, with parent support. And
Okay.
the main issue is, as we said, he doesn't have any speech, he doesn't have any words. And whatever the words that he acquired, that he used to be faded away. That was one of the worry for us at that time. So luckily we could able to find out Dr. Dashore at the time.
Right. Oh, okay. So whatever other treatments you tried, couple herbs here and there, some oils. So you mentioned that you saw some improvements.
Mhm.
He would get a couple words,
Yep.
but even the little language he gained would eventually disappear in what? In a few weeks, in a few weeks time, that would disappear. Okay, I see.
Yeah, it used to be 1 to 2 years. Yeah, 1 to 2 weeks time frame they used to
In one to
disappear.
2 weeks time frame. Okay.
Yeah,
I do remember you mentioning this vacillation of symptoms, but that is something that um, encouraged me to explore further and to be a little aggressive with Arjun's treatment as well, because that gave me the information that that is there. He's very intelligent, he's bright, he's got a good academic future as well, because if minor treatments are giving him language, that you're seeing some glimpse of language, then
yep,
once everything is organized, he's got a very bright future ahead of him. All right. And now I had discussed with you, actually, in my podcast, I usually discuss about underlying issues, and
yep,
then if you recall, we ran a lot of testing for you. Actually, you know what, Gopi and Jyoti, before that, if I may ask you, so this consultation was entirely virtual because you're near Chicago and I'm in New Jersey. So, it's very challenging to travel with an autistic child,
exactly.
especially if you have other children. It's extreme hardship.
Yep,
So many parents will ask me, and as you know, I actually treat patients in 52 countries. So in the beginning, parents have this question, that because most of us are old fashioned, you want to take your child to be seen by the doctor, and then there's a proper examination and what have you. What I found was, if we provide the accurate, not accurate, if we provide testing kits available, by mail,
yep,
to your home, and you guys run all the testing, because most of the testing is stool testing, urine testing, saliva testing, nasal swab. So that's doable by most parents. So uh, we can ship that to you, and you mail it out. Once we get the results, right, protocol becomes very customized. So can you tell me a little bit about what has been your what was the doubts you had in your mind about a virtual consultation, and how has your experience been?
Yeah, to be honest, we are new to this virtual consultation at that time. I was doubtful how it is going to work out. Hey, this doctor is not going to see the kid. We are not going to next to her, how he's going to diagnose, or and before I go to consultation itself, the major doubt that I have it is without seeing the kid, is the doctor can order any of the medical tests, and without the test, because the tests are going to be the evidence, right, what is going on
Right.
in his body. So that's where all these questions that I have it, and the response that I got it from the doctor's office was it is immediate. So from the first visit to till I think we had 4 or 5 visits. Yeah, 5 visits. I never had any of the issues related to the virtual the meetings, and it's going. I didn't feel that one. No, it makes my job easy rather than booking a flight, going to New Jersey, staying there, visiting doctor, and coming back. Yeah, yeah. In this technology world, I feel that one. This is much better than having an in-person consultation.
Yes. Okay, great. Yes, many families um, have reported exactly what you're saying, and especially now with COVID and lockdown issues. So I think many families need help. Many need answers. In India, I don't think there are. I'm not sure if there are any broad spectrum approaches to autism, or if it is limited. Are you aware of what, if there are any viable options?
To be honest, doctor, I am very new to the autism word itself when we diagnosed with Arjun, and I see that one. No, I could not able to find out any doctor the same as knowledge as you. They might be bits and pieces the information that they know.
Mhm.
Uh, they claim that one, no, they can treat it, but I do not have that confidence that whether they can treat it without knowing what is causing without what is causing the autism.
Okay. So can you tell us about what we found? We did extensive lab tests for Arjun,
Exactly.
right?
Yeah.
And
Before come to that lab test, I would like to tell why we had an consultation with the doctor,
okay.
and we stayed in an apartment where we found that one that was water leaked at that time for before Arjun was born. To be at that time we don't know that one, no, the mold is also one of the reason why the kids can have the symptoms like that.
Mhm.
So after going through all this information and also the content that doctor has provided, and also in the conference what doctor has discussed about the comorbidities or the other things. So that's where we decided to go with Dr. Dashore, and immediately in our first appointment itself, uh, doctor has ordered for the labs, and as we discussed, we went for extensive lab testing. It goes with the stool test, and it goes with an urine test, and also we had in a hair metal test, and
Mhm.
importantly we also had the HETME test, which is going to be uh, calculate the mold what we had it in the premises that we are staying at. So, and also we tested for the Lyme as well.
Okay.
So once we had those tests, then doctor has went through, and that's where we started the treatment for Arjun.
Okay. We also did the nasal swab test for MARCONS. Actually, I'm writing a book because, MARCONS, which is associated with the exposure to mold, and MARCONS is a severe deep sinus infection, and the toxins from the MARCONS cross over the blood-brain barrier into the brain, and they cause a lot of inflammation and damage in the brain. There's plenty of research studies that have been published with regards to this. So sometimes, most of the times, children with autism, it is difficult to do a deep nasal swab. It's actually deeper
Yeah.
than the COVID swab.
Oh, okay.
Yeah. So after we found out all of the comorbid infections, the mold and mycotoxin issue, and you were explained the scientific basis of what's going on with Arjun's brain and body, um, what happened next? You started on a full herbal protocol. How was the protocol? It was customized
Exactly.
to Arjun.
Yeah, we started with three phases of the protocol. I would say that one, the first phase it's going to have is the what we call it as the nutrition, all the supplements that we are going to hit few, and the second part was about the liver support, and the third part is about the detoxification. This is what we started with before we receive it, the results from the labs. So even with that, when we started around October time frame, in year 2019. Yeah, from October to February, I think February, that is where Arjun, we see the improvements right after, in between that February time frame. Earlier, no, Arjun, he never used to, between the 2 years to three and a half year time frame, he never had any of the issues related to the either fever or other cold or cough, because we treated with ear infection, so that has disappeared. So I thought, no, his gut is really good now. He's not feeling sick. So we thought everything was going good, but immediately when Arjun had fever, and he had fever around 1 or 3. So we coincidentally we had the appointment with Dr. Dashore at the same time. So we got to know that when, hey, that means even though he got fever, that means Arjun that is very positive sign. That means his gut is responding.
Correct.
So that's where immediately we got the words for Arjun. Say that one, no, whatever we used to say, like one words like mom or dad, or whatever we say, the little words, immediately he picked up within a couple of days. So that was really a coincidence. So we conveyed the same thing to the doctor. He had Doctor Arjun had fever, but even during fever also he was able to speak a couple of the words which we haven't seen before. So we got to know that one of the inflammation during that the fever time is going to be a little less. So kids will be, and that is one of the reason why we are seeing much drastic improvement immediately. So luckily we were able to build on that one, and we were able to make progress.
Okay.
So gradually I see improvement in Arjun, especially in the teeth grinding that used to disappear. Now he never ever walk on tippy toes, and also he never flap his hands. But now we have little other challenging, but I don't think that's going to there for a long time. But that major issues that those has gone, like the tippy toe walking, and teeth grinding, and also hand flapping. Those disappear immediately within a couple of months after we start the protocol with Dr. Dashore.
Excellent. Next comes cognitive improvements. Right? Didn't you mention that there was some hyperactivity with him running around the room, as well? Failure to sit down or do any academic studies and work. So, what improvements did you see with that? Now, we by this time you had also received the results back of the lab test, right?
Exactly.
So, was the protocol changed? Was it what happened?
Yeah, I will explain in really fast, so that that I can minimize doctor's time as well. I know it is precious. Before we introduce to Dr. Dashore, it is going to be very hard for Arjun to make us to sit either with us, or we used to have an therapist that the therapist used to come to our house, or we used to take him to the therapist, ABA therapist. So it's very, very challenging for Arjun to make him focus. So fast forward now, after 1.5 years, Arjun, he is able to sit in the ABA session therapies for half hour without any break off. Sometimes he goes for 1 hour as well. He's able to make focus. He has a little bit challenges when it comes to the attention focus, but at least he's able to sit during that therapy time, which is really, really important for any of the kid who had past and hyperactivities, and he could not able to tolerate to sit in any one position.
Yes. Okay. So after the protocol, after you received the lab results back, protocol was customized, and then you received a lot of antimicrobial herbals, which, right? So who manages the protocol? Because it sounds like, a pretty challenging, it's very systematic,
Exactly.
but it's not easy to do. Honestly, I mean, that's what happened to myself as well, because if you're trying to recover your child from autism, either you're all in or you're not. You just have to do what needs to be done. So I would like to speak to yourself as well as Jyoti about the diet changes that Jyoti had to make, and what improvements have you seen in Arjun's gaining weight and appetite and growth, even though he was on this specific carbohydrate diet that is recommended. So please.
Yeah, I will just speak for a couple of minutes before I let Jyoti speak.
Yes.
I forgot to mention earlier the key component after what we had appointment with the doctor was the special diet that we introduced to Arjun. Before we introduced to doctor, we cut down his milk and also we cut down the sugars. So we never know that there is a diet called a specific carbohydrate diet that the doctor has suggested. Immediately we introduced Arjun to the specific carbohydrate diet, and still we continue. Even though doctor has suggested us, you can slowly introduce few new things, but we are very, very, very strict. And Jyoti, she cooks everything from the fresh, and the amount of the time that we spend for the food itself, it's going to be it's enormous. I would let Jyoti to speak that one on that part.
Yeah, before we introduced to SCD diet doctor, he used to vomit every single meal.
Oh.
I don't know whether what's the reason exactly behind that. He used to puke every single meal, like mostly every single week. I can say that, like sometimes it used to be very hard for me.
Mm-hmm.
But after we introduced SCD diet, like initially he had little struggles, but I can say that eventually he has habituated to that.
Okay.
The diet is very strict diet,
Yeah,
and it's always cutting down all the milk. That's the favorite thing. Earlier, no, he used to like yogurt. Now, all of a sudden, we cut that yogurt. What he used to do is he used to come to us and he used to see. Then we used to feel very sorry for him. So we used to hide the things, which are the things that he likes. He used to like the bread at that time, and bread and yogurt were his buddies. So we never used to have them when he's around.
Okay. So after stopping those allergenic, because gluten and dairy can be heavy triggers, because we found out with Arjun's lab test when they came back that he has PANDAS type issues. He's got chronic inflammatory response syndrome as well from the mold exposure. So I think you guys did a phenomenal job, with sticking to the protocol, even though it's hard, as well as Jyoti, sticking with the diet. Like I've been doing the specific carbohydrate diet for 14 years now.
Awesome. Yeah, that all credit goes to Jyoti, because the amount of the time that she spends on that one, it is good. I am just the researcher, but she's the one who does that.
Beauty and the brain.
I used to feel little difficult. Yes. Because since he is too young, and I used to feel very bad for him. But after we have introduced the diet, I feel like okay, he is good now. His health, he is improving.
Yeah. So after you took away, things that everybody thinks are important for growth, like bread and milk and dairy, after you took that away and put him on the SCD diet, he started growing.
Exactly.
Like he started growing physically, his appetite got better, his gut settled down. Now, I would like to inform, everyone, before everybody, whoever is watching, jumps the gun and says, hey, I want to start the diet. Understand, please, what Gopi is trying to say is that there was a comprehensive 3-step protocol in the beginning before the lab tests came back, and we further customized. So it wasn't just the diet. There is a comprehensive foundation protocol that stabilizes the body, that recovers the gut, so that you can go on this diet. And even though it is a pretty strict diet, the child still benefits. You're still gaining weight, gaining height, gaining appetite, symptoms are going away, immune system is improving in the gut, right? If you want to add anything, please go ahead, Jyoti.
Exactly, that is a very, very valid point. I forgot to mention that one, and thanks for reminding that one, doctor. This is related to that, what you say, the gut. Even the test results that came out for Arjun was totally evident that when how his gut used to be when before the test. And right after 1 year time frame, I did the test without doctor knowing, because there was a third party, the site which was offering which is offering the gut test for cheaper price, and since they have their discount going on.
Yes.
So I test for Arjun, and the results, it came out saying that one, I cannot believe that one. No, he was at 90% compared to anybody else in the same level, or anybody else in the adults as well. Even I don't think none of the family members are, including doctor also, I will take that one. He has the gut like Arjun, what he has now. He is at 90% compared to the peers.
Oh, wow. God bless. God bless. Yeah, he's doing
that
so
tells
well.
us the amount of the effort that Jyoti has put towards the diet. And luckily, Arjun, whatever we used to give, we used to take it. We are very, very blessful for that one.
Yeah, to be honest, for him, for that, we have to just appreciate him, doctor. Like, though we used to have a typical food, but out of all that, right?
Yes.
It was really
big change.
Yeah, exactly,
and
we never had any issues with the food that after we changed CD. He used to, even though we changed the food many times, when we changed not on the diet, I used to change the vegetables frequently, saying that when is this causing a problem? Is it causing more inflammation to him? So I'll try to cut down those stuff. So we used to change a lot in that one, and especially after that one, we saw a good improvement after changing the diet as well.
His diet, good, yeah. So let's talk about his academics.
Mm-hmm.
What is he able to do now? How old is he now? Let's see.
He's 5.5 years now.
He's just 5.5 now. And after I started with him about 1.5 years ago, and he's, it's like a complete turnaround for him from what I can see. So if you can please, highlight some of his academic achievements, alphabets, numbers. Exactly. What is he able to do anything? Is he able to recognize? How is he doing?
I will tell you the background and also where he is now. Before we introduced to Dr. Dashore, even when he was around the 2 year time frame, he loves to read, and he loves to look at the books. He doesn't know how to read, right? If he will look the books in the opposite way, he will look at the pictures and he will laugh, saying that, hey, then we thought that, hey, this guy is more interested towards the book. So even before we introduced doctor, around that 3 year time frame, he used to write on his own. I know.
So he used to write it in the air. Like he used to do like this. But he simply just
scribbling. He used to scribble. Okay.
Exactly. We don't know what is that one. We asked doctor, hey, doctor, we regular pediatrician doctor, hey, we observed that when Arjun is doing something in the air, we doesn't know what he is doing it. He said that when maybe something is going on. He does know it is if you show him any of the picture like an apple or a dog or cat, he does not know what it is about. And initially we spent a lot of time at least to make him to say one letter, and it become very challenging to make him sit as well and also to make him focus. So during that 2 to 3.5 year time frame, whatever the alphabets that he learned was very handful, I would say. Okay. So when we introduced to this protocol that doctor has suggested, 3 to 3.5 year time frame, whatever the alphabets that he learned was very handful. I would say. So when we introduced to this protocol that doctor has suggested, 3 to 3.5 year time frame, whatever the alphabets that he learned was very handful. So from this within this 1.5 year time frame, I would say that he's mastered out in all the alphabets, and he's also mastered out in all the shapes, and also he mastered out in all the colors. He mastered out in all the, let's say, if you say any of the alphabet, he says the corresponding the words as well. Not only saying the word. Now, if you ask him to write, he will write it. And if you ask him to say what A stands for, he says A for ant, and he say ant means A-N-T.
Oh, wow. So he's spelling it out as well.
Exactly.
Amazing.
He spells
Okay.
that out currently. That is a really good thing. Not only the English alphabets and the same native language alphabets, whatever we write it, he loves to write it on the book. So Jyoti, all the time, what he used to do is at least 10 times in a day, she used to write it on the book. So he grasped those, whatever the alphabets that we used to write in the book. We never showed him or taught him that one, hey, this is how you need to write A, this is how you need to write B. Mm-hmm. He learned those one on his own. Now he's able to write words corresponding to that one. Now
he is able to write the words till Q.
Wow. Excellent.
Yeah.
He's doing numbers as well.
He also knows the numbers. And
till 20, but till 20, he'll do it perfectly. Mm-hmm. But from 20 to 60, like he has a little confusion when we say 30.
Because whatever he sees, what we introduce him to the
ABC,
that app where it says that one, hey, this is 33. You have to go and hit 33. So he gets confused for only few of the stuff, but he's able to match them up to, I think, 70 or 80. The numbers up to 70 and 80, he used to able to match them. That's where we see the difference as well, where he's able to sit, he's able to focus. So, but still we do have the challenging in terms of the eye contact. That's where we are working with the doctor for to make progress on that. Yep.
Yes. It's very how each child will be recovered is very individual to the child. Now, Arjun, looks like he's very intuitive, and he's very aware of what's going on with his body. And he seems to, I don't know, he seems to be in charge of showing you what things have improved. Like he's potty trained right now.
Yeah, I forgot to mention that one, doctor. Even ABA therapists, even they cannot believe. They did say that one. This is the first kid that they have seen. Any of the typical child kid got potty trained in such a short time frame. Arjun was potty trained within just 2 months time frame. Now he's fully potty trained. Now he does not know how to say I have to go to bathroom, but whenever he has to go to bathroom, he goes to bathroom.
He goes on his own. That is just exactly. So with Arjun, his neurological development with the brain, language and focus concentration, that came first. But for, the body has to decide. Everybody's body has that innate intelligence that comes into play. And for him, looks like small things like eye contact are not important. And I wonder if that's his personality coming out. He's not interested in that. He's more interested in exploring his environment and learning more. So I'm convinced that we will see, all of the other improvements that you wish to see in him, because in such a short period to see all of these gains, like he's got toe walking, hand flapping, teeth grinding, all of that is gone. His autistic behaviors are gone. He's got a couple things that need improvement, like you said, eye contact and initiating conversation.
Exactly.
But you mentioned, Gopi, that he is initiating affection. He likes to go around hugging people.
Exactly. Yeah. And he gives a lot of hugs, especially to the family members. Now, since Arjun has a challenging to socialize, what we do is When my daughter's friends comes home, he goes to them. Maybe he does not know how to speak, to how to initiate the conversation. So he goes to and he hugs them.
Yes, yes. Well, he's still so young. He's only 5, and the major period of his neurological gain was last year.
Yes.
And last year there was the lockdown. So, a lot of families with kids with autism have had to face tremendous challenges because of that. So I can understand,
Yeah, that's what we are also thinking, doctor. Really, to be honest, he started progressing like anything from last February, but unfortunately, because of the lockdown and everything, he is restricted to the home.
Yes.
So
Yes.
his socialization to the other kids, that is becoming limited, and also it becoming challenging as well. I think this year onwards, once he started going to the school, that is one of the goals that we had, where Arjun is able to socialize with the other kids.
Exactly. Once they start socializing more, academically, he is like a 5.5-year-old. I mean, the skills that he has already,
Exactly.
The teachers start to teach those in kindergarten.
Yep.
Right? Sight words, reading, being able to spell. So he already is at a kindergarten level, if I'm not mistaken.
Mm-hmm.
And so when he goes in, his brain can focus on socializing, initiating like small phrases, conversations. So so I think he does need that kind of an environment.
Exactly. The good part was before 1.5 year back, before we introduced to doctor, he does not have any words. How he used to communicate is if he wants to water, if he wants any of the things that he needs, he used to drag us. He used to point out. He used to just keep our hand the thing on the thing that he needs. Now the good thing is now if you ask him to Arjun, what do you want? He says that one, I want water, or I want banana, or whatever the things that he needs. Yeah, I want phone. I want out. I want car.
I want out.
Yeah.
And his a favorite thing is blanket.
Yeah.
Like all the times he will come and I want blanket.
Yeah.
Okay. Very
So
cool.
the good part was earlier he used to be on the mobile devices or the electronic devices for a long time. Now we strictly cut down that one. Now even though he looks into the mobile, it's very rare he asks that one. Now he's got used to that one. He watches the only videos only for I would say that from around half hour in each day, which is I would say which is really great thing in this current world where everything was digitalized.
Yes, very nice. Absolutely amazing to hear you guys speak about Arjun. It's been a privilege working with your family, and I also respect you guys a lot because the BioNexus protocol is all herbal, plant-based, but it's not easy. It is section by section.
Exactly.
But actually, Jyoti, how you managed to make his herbal tonics, to give the supplements every day, right? To do the detoxification, it's just fantastic. Hats off to you.
We didn't even miss a single day, doctor. Even for him only, we won't go outside, and we try to.
Yeah, we try to be at home most of the time
with him, and all the time we are just expecting something for him to happen.
Yeah. It is, isn't this all worth it? It's completely non-invasive treatment. You have to give it a few years to work because, like I had mentioned to you, if there are so many underlying infections that can go in the brain, that can go into organs, if there is mold toxins, that is also a multi-organ problem. And if you're giving your child a couple of years worth of all natural treatment, nothing invasive, not a single needle anywhere near him, and you're seeing this improvement to the point where he is going to go into school at the same academic level as regular kids with a couple socialization problems, which will be resolved, it's worth it because it is going to affect the rest of his life.
Definitely. That's where we introduced to doctor, because the moment that we see it, it's always all the plant and herbal treatment. So there is no other steroids or other things which is going to harm him. That's why we choose Dr. Dashore.
Right. Well, I'm glad you did. It's been awesome working with you
It's
guys.
our pleasure, not just
Yeah,
be glad
to
that
be honest, we have to we'll thank every single day, doctor.
Yeah.
We'll thank you every single
We are
day.
like you are like God for us.
Oh my goodness. No.
Yeah, that's why we say that when no, even if we are not, if you are upset, that's why we used to convey to you, saying that when, hey Arjun, sorry, hey doctor, this is not what we felt, this is not going well. And that's where we used to say all the things to you, doctor. We treat you like a god. Yeah.
I'm just a vessel.
No.
I've been given this blessing.
I know how much stuff going through the journey of a kid who has an special needs, especially with autism. Yeah. Yes. I know. I can imagine now the amount of the stress that you have gone through when you are treating Brian.
Yeah.
And during that Brian term, I got to know that no, we don't have what you have currently. Yeah. At the time, everything you used to need to research and you used to consult with a number of doctors. Now we don't need to consult multiple doctors.
Yeah.
We are consulting only one doctor, that is you.
Thank you. I appreciate that. Yes, it was a tough journey with my son, but because of those 7.5, 8 years of what Brian went through and the kind of research that I did, now that I'm able to bring all of that to families like yours.
We are so thankful for Dr. Dashore for the amount of the effort that she put towards Arjun. And she not only supported Arjun, she also supported us in many ways, which I cannot express my ingratitude, because I'm in online. Not only the person, she treated us like a family, which I don't see that when you have that connect with any of the doctors. I can bet on that.
Thank you. Thank you so much.
Thank you so much, doctor.
Yeah.
For all of your kind words. And this, this is going to help so many families around the world, because many children diagnosed with autism don't have any hope from local doctors because of lack of awareness and lack of experience. Most pediatricians are well-meaning. Every practitioner wants to see their child patient, pediatric patient do the best, achieve their best, but there's lack of awareness. It's just, sometimes it takes personal experience to be able to arrive at answers. So thank you very much for being here today and sharing your story with us here. I appreciate it very much, both of you, Jyoti and Gopi. Thanks a lot.
Thank you for having us,
Doctor, once again.
And for everybody watching, I hope you have listened carefully to this session, because this family, these parents have shared a lot of clinical pearls. A lot of golden nuggets have been shared when it comes to attempting to recover a child from complex autism. So thank you for joining us on this episode of BioNexus Health Autism Uprooted podcast series. I look forward to seeing you at the next episode.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.